What percent of your scalp hair should you lose before it becomes apparent to anyone? Hello ladies and gentlemen, our topic for today is the drug Dutasteride. After watching our video on finasteride, you probably turned up your search engine looking for other remedies to hair loss, hoping for that divine miracle of hair growth to drop in suddenly from Google's ample bosom. After hours of despair, you probably encountered the drug Dutasteride. But what do you actually know about it?
I think I know the answer, Mr. Garrison.
What is Dutasteride? One peculiar thing about this drug is that it is gender-friendly. Dutasteride is a medication used primarily to treat benign prostatic hyperplasia or enlargement of the prostate among men.
Hey, that's pretty good.
For women who have excessive hair growth or hirsutism, this drug is a savior. So no need to take out the weed whackers, ladies. Interestingly, hormone therapy for transgender women includes estrogen and apparently Dutasteride. I'm starting to sound like a 1920s snake oil salesman now, but this drug can actually do a lot. How does Dutasteride work? Like finasteride, Dutasteride is a 5-alpha reductase inhibitor. It works by blocking the enzyme 5-alpha reductase that converts testosterone to dihydrotestosterone or DHT. What does DHT do? DHT is a type of hormone derived from testosterone that contributes to male sex characteristics when you go through adolescence. It is responsible for that
Deep, manly voice?
bulky and toned body, and longer and bigger penis and testicles. All thanks to puberty. As you achieve that masculine physique, DHT becomes less important for your everyday well-being. For genetically predisposed adults, DHT links to receptors on hair follicles in the scalp. It can shrink the hair follicles and shorten the hair cycle. This causes hair to grow out, looking thinner and more brittle, and the hair to fall out faster. This eventually causes the hair follicles to stop producing new hairs. Over time, this can result in a receding hairline and a bald spot in the crown of your head. If not treated, this progressive hair loss may continue through the years and potentially affect all of the hair at the top of your head, sparing the sides and the back. Hits close to home, right? And this is where Dutasteride exerts its action. By blocking the conversion of testosterone to DHT, it prevents, slows down, and even reverses hair loss in men. From pseudo-hermaphrodites to Dutasteride, have you heard of guevedoches? Probably not. In 1972, studies were done on a group of children in the Dominican Republic who appeared to be females at birth. But at puberty, these girls developed muscles, testicles, and a penis, and they went on to live their lives as men. Surprisingly though, their prostate gland remained small, and so they were referred to as guevedoches or penis at 12. They later found out that the underlying defect was a deficiency of the enzyme 5-alpha reductase. They were struck by the possibility of creating a drug that keeps the prostate small. Then came the birth of finasteride in 1992, followed by Dutasteride. Dutasteride was patented in 1993 by GlaxoSmithKline under the brand name Avodart. It was approved for use in 2001 for the treatment of symptoms of benign prostatic hyperplasia. The patent expired in 2015, And so the drug has since become available in a variety of generic formulations with the same active ingredient, dutasteride, and the same effectiveness, but more affordable. It was approved for the treatment of scalp hair loss among male adults in South Korea in 2009 and in Japan in 2015. Now, we know their secret. And for the rest of the world, this drug is now becoming more popular as a treatment option for male pattern hair loss. I feel good. How is dutasteride different from finasteride? Both are proven at treating male pattern hair loss, but studies have shown that dutasteride may be more efficacious. Men who took the drug had thicker hair and higher average hair count after 24 weeks than men who used finasteride. How so? Do you remember the enzyme 5-alpha reductase? Yes, that's where they mostly differ. Finasteride works against type 2 5-alpha reductase, while dutasteride works against both types 1 and type 2 of the enzyme. Theoretically, a more powerful inhibition. It blocks 90% of DHT compared to the 70% by finasteride.
Hold up. Hey, well, my niggas who be thinking we
Dutasteride has a longer half-life of 5 weeks versus the shorter half-life of 5 to 6 hours of finasteride, meaning it stays in the body longer. How do you take dutasteride? It's usually prescribed in 1.5 capsule taken once daily. However, many users have reported positive results by just taking it thrice a week. You may take this medicine with or without food, so remember to swallow the capsule whole and do not crush, chew, or open it. There is not a best time to take it. Choose one that works best for you and make sure to take this drug at the same time every day. What if you miss a dose? If you miss a dose, take it as soon as possible. But if it's almost time for your next dose, skip the missed dose and go back to your regular schedule. Do not take a double dose to make up for the missed dose. How long does it take before dutasteride works? Depending on the individual, it generally takes about 3 months to show its initial effects, although it can take up to 6 months for others. You may notice some thinning of the hair during the first few months of treatment, but this is temporary due to the shedding of miniaturized hairs. The effects of dutasteride last only for as long as you take the drug. Once you discontinue use of this medication, you'll gain more head and lose more hair. Again. What are the effects of dutasteride? Just like any other drug, it also has side effects. They are usually mild and they go away as soon as your body adjusts to the medicine or as soon as you discontinue the therapy. However, it is advised to consult with your doctor if they persist or worsen. So these side effects include decreased libido, problems with erection and ejaculation, and breast enlargement. Who cannot take dutasteride? This drug is not suitable for everyone. If you are a woman or a child below 18 years old, if you have allergy to 5-alpha reductase inhibitors or any of the drug's components, and if you have a severe liver disease, this drug may not be for you. So what other special precautions should be taken? Before taking this drug, inform your doctor if you have a mild to moderate liver problem, if you have prostate cancer, and if you are taking any of the drugs like verapamil or diltiazem, HIV medications, and antifungals like ketoconazole and itraconazole. Your doctor may adjust your dose and order blood tests for monitoring. Pregnant women or women who may become pregnant should not handle or touch the capsules. Dutasteride can be absorbed through the skin and cause birth defects in male fetuses. If a pregnant woman comes into contact with this medicine, the affected area should be washed right away with soap and water, especially if the capsule is broken. It is also advised not to donate blood until 6 months have passed since your last dose. Dutasteride can remain in your blood for a long time and be passed on to a pregnant woman who receives a blood transfusion. Is dutasteride better than finasteride for hair loss? Research has shown that both are effective in treating hair loss and both are extremely safe and well tolerated.
Nice.
There is no one medication that applies to everyone. Treatment is always personalized according to the patient's preference, response, and tolerability. Hair loss can be devastating. If you are suffering from hair loss, why wait before you lose 50% of your hair strands before others start noticing that balding head? So remember, good doctor, free online consultation.